We are all about facts, not fear, and providing info to keep you and your loved ones safe. So today we have some coronavirus numbers to share. The CDC reports that there have been 119,615 deaths in the U.S. alone due to coronavirus. In fact, 23 states, including California, Oklahoma, and Georgia, are seeing numbers on the rise. Dr. Kohli joins us live. Doctor, okay, so there's a lot of speculation as to why these numbers are going up. If you had to pick one reason, let's just simplify it, one reason, what do you think that is?
Oh, that's hard, Sam. Can I have two reasons, please?
No. Of course you can.
Okay, so my top two reasons, lack of masks and lack of social distancing. It's plain and simple. So if you look at the other countries around the world that are counting death rates in the hundreds, not the hundreds of thousands like we're doing here, they don't have a special treatment, they don't have a special vaccine. The only difference between them and us is that they're following the rules. Now, we've all seen those pictures of those crowded beaches, crowded restaurants, crowded bars, but over the weekend, we actually learned that many of the new infections are now occurring in the young people. So the people that seem to be breaking the rules are the young people. In fact, in Florida, they now say that the median age of infection is 37 years and that 62% of the new infections that occurred the week of June 7th occurred in people under the age of 45. So I think this is a real shift. If you think about it, when the virus first came to the country, it was an elderly nursing home in Washington state where we were seeing the outbreaks. And now we've got a median age of 37, so we've got much younger people being affected. And I really think it's a number of different factors. It's quarantine fatigue, it's the fact that it's summer, and it's the fact that young people know and understand that their risk is very low, so they're just not motivated to follow the rules and protect the others in the community.
Great answer, Doctor. Now, what determines if it's a second wave or a surge? Is there a difference between those two?
Yeah, I'm glad you asked, Jeff, because I want to clarify the difference between a wave and a peak. So a wave means that your cases went up, came all the way down, and then started to go up again. That's a wave. A peak means that they've come up and they maybe flattened and then they started to go up again. So I would say we're still in the first wave, but we're having a second peak or a second surge. So I like to use analogies a lot, and I know Sam loves my analogies, but it's sort of like we were hemorrhaging to death, you know, and we put pressure on the wound. So we stopped the hemorrhage, we flattened the curve, and now we've gotten bored, we've taken pressure off the wound again, and those cases are starting to go up. So we're still in the first wave, but this is a second surge or a second peak.
Now I got a medical analogy from you this time, not a dance one, not a swim one. So here's the thing, though, Dr. Kohli, many people are still not wearing masks. You mentioned quarantine fatigue earlier. In your opinion, is it that people have gotten lazy? It's the fatigue, or do you think people legitimately, some people do not care?
Yeah, I don't understand it, Sam, to be honest, because I know masks are uncomfortable. It's summertime, they're hot, but I think we really have to pivot from being the selfie generation and thinking about ourselves and what they're doing for us to thinking about others. So in my opinion, there's no good explanation for not wearing masks right now because we know that they work.
Yeah, I really hope that we can somehow come together on this. We've been saying it from the beginning, right, Dr. Kohli? We're all in this together.
I just don't understand people who refuse to wear masks. I mean, it doesn't make sense in my brain, Doctor.
Yeah, I know. Well, we appreciate you
Me
as
either,
always.
you guys.
We will see you tomorrow, Doc. If you guys have any questions about coronavirus that you want answered by Dr. Kohli, write us on social media. You can also email info@dailybosslive.com. And of course, no panic, just prevention and precautions.